And I think all of us that are looking at artificial intelligence are grappling with this issue, which is, what does the future hold? How are we going to use these incredibly powerful tools to transform our practice, to improve our ability to take care of patients? What do we need to know as healthcare providers to empower us for the next 3 years, 5 years, 7 years, et cetera? So I'm going to take us back, probably 5, 6 years ago, maybe even before that, where this journey started. And for me, again, this has been just an incredibly rewarding journey. I've been so proud and so honored and again, so privileged to be working with such great partners at AI Doc over the years. But if I were to start, I would say that we sort of had this concept of, what if we could just diagnose a pulmonary embolism right off the scanners, so-called CAD or CAD. And that's been going on for quite some time, and that wasn't so novel. There are a lot of other vendors that were doing that, so-called having the computer diagnose the pathology before the human being could, or before the radiologist could. But obviously that's not enough anymore, and healthcare has changed so much, and there's so many incredible tools that have come online. We've all been thinking of, how can we really use the technology to transform our care, make it a more rapid triage process, and then use all the data that the patient's coming in with, not only at their clinical presentation, but in their history in the electronic medical record, to allow us to triage them, care for them in a much more timely and impactful manner. So just after comes the automatic notification. So what if you could completely automate that the reading physician, the diagnostic radiologist, is notified? And again, this sort of goes in line with computer-assisted detection. It's computer-assisted notification. That's been out for quite some time as well. But what if we actually look forward and look to where the patient needs to be treated at the bedside? Maybe it's not the diagnostic radiologist who's actually going to be treating the patient, writing the orders, trying to triage whether or not they need any advanced therapy. What if we could get that message out the moment the patient is diagnosed with an acute cardiovascular event, in this instance, the pulmonary embolism, to the pulmonologist, the interventionalist, the surgeons, the emergency room physicians, as an example? And could we notify them where they're working, so in a mobile application? And then could we allow all these stakeholders, this virtual team, if you will, to be able to communicate seamlessly no matter where they are in the hospital, whether you're in the emergency room, in a cath lab or an interventional suite, in the operating room, but be able to have all the information in the palm of your hand and be able to triage the patient and to come to a consensus on what should be done next. And then lastly, and we were just talking about this before we came live, what if we had the entire EMR at our fingertips within this virtual environment, being able to chat? Wouldn't that be a powerful tool? And I'll tell you, that's where we are right now in 2024. And it just really is such a bright future that we're all facing, being able to aggregate all these tools to provide better patient care.